So guys, today we are going to discuss on the gastric issues in pediatric cases. So what are the pediatric issues you are facing in your practice, especially of gastric issues? कैसे बच्चे आते हैं? They have some gastric issues.
तो constipation सबसे ज्यादा आता है.
Yes, constipation is always there in pediatric patient. So what are the remedy for constipation in pediatric cases? Any other issues you are facing except constipation? Another thing is diarrhea. One is colic, especially in infant. It is evening colic and all such things that is quite difficult to treat with allopathic medicines. So we are going to discuss that part also. Vomiting in pediatric patients. Any other issues you are facing in your practice or pediatric gastric issues? These are the common things. And in pediatric, my first choice of prescription, when in any age of group, first of all, when patient is thirsty, when kid is thirsty, you can think of bryonia, constipation, child is not able to pass stool, hard knotty stool. It is quite difficult to pass stool when parents are coming to you and saying बच्चे को constipation है. तो always ask the question कि constipation में उसको क्या हो रहा है? Cause according to parents, constipation कुछ हुआ और हो सकता है. या when patient is coming to you कि मेरे बच्चे को gastric issues हो रहे हैं. तो even in those cases, you have to ask कि आपके बच्चे को gastric issues में क्या हो रहा है. There and then you will get to know कि भी gastric में उसको colicky pain हो रहा है, burning हो रहा है, irritation हो रहा है, flatus pass कर रहा है, या फिर constipation है या diarrhea. So make a habit कि patient आके बोले कि मेरे बच्चे को constipation है, तो don't take it as a diagnosis कि constipation ही है. You just rule out कि constipation में बच्चे को क्या होता है.
Yes.
Yeah. When parents are telling you कि बच्चे को constipation हो रहा है और he requires training to pass the stool. What are the remedies? कौन सी मेडिसिन आप प्रिस्क्राइब करोगे? Great strain is required to pass the stool. Anyone?
Sanicula.
Sorry.
Sir, sanicula.
Yes, sanicula is one of the remedy. Then
Alumina.
alumina is there, but the leading symptom of alumina is anyone?
Soft stool
Yes.
and straining. But
Soft
great
stool
straining.
require great straining. That is
Yeah.
the indication of alumina, guys. Alumina में constipation में बहुत कुछ लिखा हुआ है. Dryness लिखा हुआ है, like bryonia, great straining लिखा हुआ है. लेकिन leading symptom of alumina prescription is that soft stool. बच्चे को stool soft आ रहा है, semi solid आ रहा है, liquid आ रहा है, although बच्चा requires straining, or although he is suffering from constipation, then you must have to think about alumina. लेकिन stool hard आ रहा है, naughty hard stool, कौन सी मेडिसिन दूँ?
Macmure.
Yes. मैग्म्यूर का स्टूल कैसा होता है?
Like a sip tongue.
यह सिप डक कैसा होता है?
Dark black round.
Yes.
Black round balls like.
This kind of symptom you just get only in pediatric cases, guys. Adult patient आपको आके नहीं बोलेगा कि मेरा स्टूल ऐसा हो रहा है. As nowadays people are using Western toilet, so it is quite difficult to get the characteristic of stool in patient. especially in adult patient. But when we are talking about pediatric patient, parents are observing such thing and they will let you know कि सर मेरे बच्चे को ब्लैक स्टूल आ रहा है, नॉटी हार्ड स्टूल आ रहा है, बॉल जैसा स्टूल आ रहा है. When they use such terminologies, you can think of remedy that is Magmure. Can anyone read Magmure from Boric? Guys, Magmure. How many of you are using Magmure in your practice? Can anyone read it from Boric, Magmure?
Constipation of infants during dentition, only passing small quantity, stool naughty like sheep's dung, crumbling at the verge of anus, painful smarting hemorrhoids.
Yes, that is Magmure. And main thing of Magmure and Macab is they have constipation and diarrhea from milk. So when child is suffering from any gastric issues from milk, then you can think of this remedy, Macab and Magmure. The difference between Magmure and Macab. Anyone? Anyone, guys? See, there is mentioned in Magmure, continuous rising of bile forth into mouth cannot digest milk. So Magmure and Macab are not able to digest the milk. What are the differentiating point between Magmure and Macab?
In makeup, it causes diarrhea like frog's spawn.
Yes. So when you get the patient having diarrhea from milk, think of Macab. And when patient having constipation from milk, think of Magmure. This is the differentiating point between Macab and Magmure. Any one of you know the mental difference between Macab and Magmure? That is written in Sol. Sol Materia Medica by Rajan Shankar. Anyone? Anyone read Sol from Rajan Shankar, Magmure and Macab? Macab having fear or dreams or threatening from the from the people of house. Patient having dreams of escaping or patient having dreams of somewhere कहीं पे खो जाता है, that is in the house. That is Macab. And when patient having a threatening fear or he or me missed out outside the house or in jungle, you can think of Magmure. This is the mental differentiating point between Macab and Magmure. We all know magnesium group is for 4-second filling. तो जब भी 4-second filling मिलती है, वो जब भी orphaned child मिलता है and suffering from constipation, you have to think of Macab or Magmure. Macab for diarrhea, indigestion from milk, and Magmure from diarrhea or indigestion due to milk. Even if I'm not wrong, when you are practicing, you will not get only the patient having diarrhea during dentition. Some kids having constipation during dentition. So what is the medicine? Anyone? Constipation during dentition. Anyone? The remedy is Mule.
Metmure.
You already read. Someone already read. So,
Yes, I have read it.
so not in every बच्चा you will get the diarrhea during dentition. लेकिन जब भी dentition के time में when बच्चा having constipation, you can think of this remedy, that is Megmure. One of my favorite remedy. You can easily use it when बच्चा having constipation or naughty hard black stool. You can think of this remedy, and it works.
सर ओपियम भी देते हैं क्या?
Opium is, there is mentioned in Materia Medica that opium is used for obstinate constipation, but till now I never get result in constipation from opium. मुझे अभी तक opium से result नहीं मिला है. I used many times. When I get stuck in the cases of constipation, I used it, but I didn't get result. So for me, constipation के लिए opium is not helping much. Okay.
ओके सर.
The another remedy that is most commonly used, that is Senecula. Any indication you know of Senecula? Most frequently used remedy for constipation. Indication.
Stool is very offensive.
Okay, yes. Then,
And after a lot of straining, only partial stool is expelled.
okay. Anything? पेशेंट के पेरेंट्स आके बोलेंगे बच्चा बहुत स्ट्रेन करता है और उसके बाद भी थोड़ा सा ही स्टूल बाहर निकलता है. That is mentioned in Bori, open Senecula, rectum, after great straining, only partially expelled. बच्चा बहुत जोर करता है और उसके बाद भी छोटा सा स्टूल या बहुत कम स्टूल बाहर आता है. Then we can think of this remedy, that is Senecula. And the leading symptom of Senecula is excessive perspiration like calcarea and silicia. Excessive perspiration, especially on the occipital region. Along with that, when bacha is suffering from dandruff, you can think of this remedy. No desire until large accumulation. कई बार when you get the symptom कि बच्चे को एक दिन skip हो जा रहा है, stool gets skipped for one day. In those cases, you can think of Senecula. और दूसरे दिन जो स्टूल आता है उसमें बहुत स्ट्रेन करना पड़ता है. Then think of this remedy, that is Senecula. Even Senecula helps in diarrhea in children. Diarrhea in pediatric patient, we can also think of Senecula when we get the peculiar symptom, the perspiration and the dandruff. Senecula is also specific remedy for enuresis when you get the symptom of perspiration. Another remedy we will talking about, that is Bryonia and Pulsatilla. In any age of group, the most commonly used medicine in our practice, that is Bryonia and Pulsatilla. What is the differentiating point between Bryonia and Pulsatilla? Anyone?
So thirst, pulsatilla is thirstless.
Yes. Pulsatilla is thirstless remedy and Bryonia is thirsty remedy. So when you get the patient कि सर मैं 2 या 3 या 4 लीटर पानी पी जाती हूँ फिर भी मुझे कॉन्स्टिपेशन रहता है, मैं बहुत पानी पीता हूँ फिर भी कब्जी रहती है. In those cases, you can think of Bryonia. And opposite to that, there is thirstlessness, and when the patient having constipation, you can think of Pulsatilla. Pulsatilla के leading symptom, key symptom of Pulsatilla. Anyone? Pulsatilla, very commonly used remedy. Indication. Anyone?
Sir, changeability.
Yes, that is for diarrhea. See, Pulsatilla helps in constipation as well as in diarrhea. So when बच्चे के parents are coming to you and saying you कि sir या madam ये हनी कहाँ से है? जब पेरेंट्स आर टेलिंग यू कि सर बच्चे को एवरी टाइम स्टूल पास करता है तो डिफरेंट कलर का स्टूल पास होता है, कभी व्हाइट हो गया, कभी येलो हो गया, कभी वाटरी हो गया, कभी ग्रीनिश हो गया, मल्टी कलर स्टूल, डिफरेंट कलर स्टूल. We can think of remedy that is Pulsatilla, and another remedy
Podophyllum.
that is Podophyllum. Polychromatic, one of the P of Podophyllum. Different color stool. Parents आएंगे आपके पास और they used to say such thing कि हर बार स्टूल जाता है तो अलग अलग कलर का स्टूल हो रहा है. Think of Pulsatilla and Podophyllum. Any leading symptom of Pulsatilla? Pulsatilla के likings क्या होते हैं? What are the desire of
Pulsatilla
Pulsatilla?
relieved by open hair.
Open hair, okay. नहीं, I'm talking about food desire.
Pastry, ice, fruits, वो सब.
Yes, pastry. And when बच्चा having desire for pastry और हर बार वो बर्थडे में जाता है, बर्थडे पार्टी में जाता है, केक खाता है और डायरिया हो जाता है, थिंक ऑफ पल्सटीला. पेरेंट्स आके बोलेंगे कि मेरा बच्चा जैसे ही बर्थडे पार्टी में जाता है, पेस्ट्री खाता है, केक खाता है, शी लव्स केक, लेकिन वो खा नहीं सकती है, खाती है तो उसको डायरिया हो जाता है. पल्सटीला डिजायर फॉर पेस्ट्री, पल्सटीला एग्रावेशन फ्रॉम पेस्ट्री. और पल्सटीला को डिसलाइकिंग क्या होता है? एनीवन?
Warm food, drink, fat food, tobacco.
Okay, any specific thing?
Oily food.
Dislikes?
Oily food.
Version? Most commonly used?
Butter.
Yes. Pulsatilla having aversion to butter. Guys, पल्सटीला को बटर पसंद नहीं होता है, उसको पेस्ट्री भले ही पसंद हो स्वीट, लेकिन उसको बटर पसंद नहीं होता है. We learn in our college life कि disliking or aversions are more important than desire. So when you get the disliking or aversion, that is more important. So when you prescribe Pulsatilla, ask the parents कि उसको बटर पसंद है, and that you can confirm Pulsatilla from disliking of butter, aversion to butter. And Pulsatilla is always thirstless. Along with that, appetite is excessively reduced. बच्चा कुछ खाता ही नहीं है. Parents will come to you and say कि मेरा बच्चा कुछ खाता ही नहीं है. Ask them कि वो पानी पीता है. If appetite is reduced along with thirstlessness is there, think of Pulsatilla. If you get mental symptom, that is better thing. If you don't get mental symptom, you can simply prescribe Pulsatilla to increase the appetite. कई बार बच्चों के अंदर taste are not that much developed. Parents will came to you and say कि सर मेरा बच्चा स्वीट ही खाता रहता है, मेरा बच्चा तीखा खा ही नहीं सकता है, मेरा बच्चा सिर्फ रूटीन डाइट ही लेता है, वो कुछ नया इंट्रोड्यूस नहीं कर रहा है. इन दोस केसेस थिंक ऑफ पल्सटीला. Another remedy, loss of taste, that is Nettermute. So we like such things, we can think of these remedies. You know कि loss of taste है, लेकिन where you have to use, this is the condition. यहाँ पे आपको उसको यूज करना है. Dry mouth without thirst, that is Pulsatilla. Another remedy, the leading remedy for constipation, anyone?
Sir, Chelidonium majus.
Yes, Chelidonium. कहाँ पे यूज करना है? What will be your indication of Chelidonium?
Sir, stools are sheep-like.
कैसा होता है स्ट्रिप लाइक? मुझे सच में नहीं पता स्ट्रिप लाइक स्टूल कैसा होता है. एनीवन? रिबिन लाइक होता है, स्ट्रिप लाइक होता है, पॉपकॉर्न लाइक स्टूल होता है. पॉपकॉर्न लाइक स्टूल किसमें? एनीवन? पॉपकॉर्न लाइक स्टूल.
Sina.
या कौन बोला?
Excellent.
अनुपमा. एक्सीलेंट. Popcorn like stool, that is Sina. Ribbon like stool,
Arnika.
yes, that is Arnika. कौन बोला ये? भाग्य.
Himanshi.
हिमांशु, yeah, हिमांशु.